Hello, everyone. Welcome to Health Talk Show. I'm Dr. Farhan here, joining you from Philadelphia. And today it is my pleasure to invite one of my close friends, Dr. Atul Kalanuria. He is an assistant professor of neurology, neurosurgery, and anesthesia critical care at UPenn, University of Pennsylvania. Atul, welcome and thank you for taking the time to join me. How are you?
Thanks for inviting me, Farhan. I'm good. How are you?
Good. It's been a while. We did not have a chance to sit together because of the COVID crisis, and I hope you and your family is doing well.
Yeah, as well as everybody else, I guess. It's
Yeah,
these are strange times.
strange times. I I wanted to reach out to you because you have an interesting professional background, a physician trained in internal medicine, neurology, and now taking care of neurocritical patients. You bring in a lot of talent to the table. I want to ask you a little bit about your life history so that people can get inspiration and aspiration from your life's journey.
Sure.
So tell me a little bit about you, Atul. Where are you originally from and where did you go for medical school?
So I'm originally from a city called Mumbai. It used to be known as Bombay. It's on the western part of India. Uh, it's a very cosmopolitan city, and it's a potpourri of many different, cultures. And it's basically the New York of India. So, you'll find people from different states. So you'll have people from southern India, eastern India, northern India. So I got a very sort of enriched environment to grow up in, and I had friends from different backgrounds. It was really a fun time back, when I was growing
Growing
up.
up, yeah.
Yeah, so all of my education was in the city. It's a huge population. I think there's like 20 million people, and it's a large academic town as well. It's got tons of great high schools and colleges and medical schools and engineering schools. And so I was fortunate enough to get into one of the medical schools in the city. So I didn't leave my hometown until came to the States.
So it's a KJ Somaya Medical School.
Yeah, yeah.
Okay, wonderful. So 1996 to 2002.
Mhm.
Soon, it seems like that. Eh, it, Tell us a little bit about medical school in India. Does that also include a house job right after you finish?
Yeah, yeah. So it's 3 years of medical school. Each year is 18 months, and the structure is similar to the British way of going, medical school, where you had your basic sciences in the first year, you had some bridging sciences in the second year, and the third year was your clinical year with, the main core subjects like medicine and surgery and OBGYN and things like that. And then once you finished those 4.5 years, you gave a test. If you passed, then you did a 1 year internship, which included working as a house officer in a hospital, and you rotated through different departments. That's how you spent your 1 year. And once that's done, then you get your certificate and you're qualified to work.
So Atul, during that house job, is it not that you choose a field of 6 months and you work in that and then you choose another 6 months, or is it multiple departments you go through?
It's 3 months of medicine, 3 months of surgery, 3 months of OBGYN, and 3 months of pediatrics. Um,
And
and
that's compulsory. Everybody has to do it.
everybody has to do it. Yeah, you
Okay.
have no
Okay,
choice.
that's interesting.
Yeah.
Um, so do you remember any fun things from your medical school? Any event, anything that you still think of it? And if your friends are listening, they
So
would like, Atul, yeah, that was good times.
I think some of the best days of my life were in medical college. We used to call it medical college. It was
Yeah,
not medical school.
yeah,
But
medical, we used to.
I still am in touch with some of my friends from that time. I think I had a blast in my 4.5, 5 years of medical college. I met my wife during medical college, so I've known her for a long time. So there's
Yeah.
that importance right there. Um, and then yes, we built really strong friends, good friendships. Had lot of fun. It was just if I had to do it over again, I'll do it
You'll
definitely.
do it again. Were
Yeah,
you, so you must have been a non-boarding student. You were traveling from home every day?
correct.
Yeah.
I was
Okay.
traveling from home every day. Yeah.
Okay. So let me ask you, what made you decide to be a physician?
So my upbringing was very traditional. It was not, you know, basically the when I say traditional, what I mean is the parents have a big say in what the kids do.
Yeah.
And it's not the same nowadays. I know the kids have, a lot more options too, so they can decide to do whatever they want, what they're good at. But for me, it was very structured. I was always good in school in science, and I used to love the subject, particularly biology. And when I went into high school, the same thing happened. I was always better in the science versus the math part of my high schooling. Um, and then my father one day took me to this education counselor who gave me a test, essentially, and I gave that 3-hour test. It was an aptitude test. And they don't tell you exactly what you need to do. They don't tell you you're going to be a doctor or whatever. They just say you'll do better in the science subjects, particularly biology. So right then and there, my father said, you should try applying for medical school. And so I did, and I actually got into engineering school and medical school based on my high school grades. But my father said, I think you do a
Your
better job as
calling
a
is in
physician.
better at.
Yeah.
Okay, good. So you finished your medical school in India, and then when did you decide to come to the United States?
So, like I said, I had a lot of fun in medical school.
Yeah.
And I actually, till the last day of medical school, did not know what I'll be doing next. And it's an interesting story. I still remember I was in the medical school. I was going upstairs or downstairs, I don't remember, but I bumped into my pharmacology teacher
Hmm.
and professor. And she said, "Oh, so you're finishing up?" I said, "Yes." She's like, "What are you going to do next?" And I guess she was expecting an answer like, "Oh, I'm applying for post graduation in Bombay, or I'm applying for an all India test, or I'm going to the US or UK or Australia, whatever." But I said, "I don't know." And so she she paused for a minute because
She wasn't
I was
expecting
not I
that
was
from
not
you.
yeah, admittedly, I was not a top student. I never failed, but I also never made it to the rank lists ever.
Hmm.
I just
Hmm.
had too much fun, I think.
Yeah.
But so she said, look, there's a pharmaceutical company. There's lots of pharmaceutical companies in Bombay, and she said she had a friend that worked at one of them, and she said, why don't you talk to him? They're looking for a physician to help in their medical department. And I had no idea what this was.
Okay.
So I said, sure, why not? The company was close to my house. I said, why not just go and interview? What do I have to lose? So I went. And this is fresh out of medical school, the day after my medical college. I wore a tie, dressed up formally the best I could. I was very uncomfortable, but then I went in this you know great looking place, completely you know sort of professional with people moving around in suits. So I went there. I gave my interview. They interviewed me for a good 4 hours because I was only 22 without any experience, and they said, we got to test you right. So I was there. They interviewed me, and then the next day they called me and they said I'm hired. So I went to work with in a pharmaceutical company. It was a multinational pharmaceutical, and I spent 2 years over there. And while working, I decided it was not challenging enough for me. I guess
Mm.
you know there was some maturity that was kicking in, and I got married during that time. So
Uh-huh.
I had a wife now, you know, my current wife. So I had to, think about things differently.
Yeah.
I said enough of fun, and I think I need to take things seriously. And I gave my U.S. medical licensing exams, and next thing you know, 2 years later, I was here.
Yeah. Wow. So, what was her opinion about you leaving the country and coming to a foreign land and starting life together as a young couple?
She didn't have any objections or sort of strong intentions to come here. Both our families, luckily we come from good backgrounds, so we back home, we were very happy, and she was happy with her job then. But she realized that if I had to do a post graduation in India, I would have to leave Bombay and go elsewhere for 3 years, and it would be sort of difficult.
Oh,
Yeah, and she,
that,
we had, she's visited the U.S. before we had moved, so she knew what the life looked like. And she said, "All right, let's go with the flow. Let's see what happens." And here we are,
yeah,
16,
you trust your guts and
17
you
years
you
later.
know you leave it to the creator who who finds ways for us our lives. So how was the process of finding residency, and where did you start your residency?
So I actually, to be honest, did not know much of the system. I had a few friends who had come through the, U.S. licensing system, but somebody was in pediatrics, somebody did surgery, and so I didn't really have a mentor per se.
Hmm.
So I just went through with the instructions given online and things like that. So just gave my tests, took those scores, applied to many places, and I interviewed mostly in the Northeast because that's where we have most of our family and friends. Um, and then I started did my internal medicine residency in a hospital called Crozier Chester Medical Center. It's about 20 miles south of Philadelphia.
Yeah,
Um, Excellent community hospital. Lots of house staff. Had so many subspecialty residencies and training programs. And at that time, it was an affiliate of Temple, so we had some connection with Temple Hospital. And
so
then
that was internal
subsequent
medicine.
internal medicine. And
Okay.
then midway through that, I realized that I liked neurology so much that I wanted to switch over. And so I went to my program director and I said, look, I'm I really, I think I'm enjoying myself here, but I also feel like I want to do neurology. So he said, look, you have one more year to go. Why don't
Completed.
you complete it, because it will give you some additional training and experience that you can't really get back
Yeah,
once you
yeah.
leave. And his advice was right. I till today don't regret it, completing my entire internal medicine residency. Plus, at that time, overlapping with my residency was my wife's dental school, and so she was in New York, and so I said it would be better to finish it, find out where I'm going to be next, and then move together instead of moving separate.
Interesting. Very good.
Yeah.
So then you went on for another
Yep.
residency in neurology at
Yep.
Drexel.
Yep.
So, so you stayed in Philadelphia, huh? And
Yeah. Philly is home away from home.
yeah, home
It
away from home. How was Drexel University experience in neurology?
was amazing. I mean,
Hmm.
till today, you know, I think the way to judge your training program, looking back, is how much of it you can remember, stuff that
Yeah,
you learned.
yeah,
And I'll tell you, the stuff I remembered from then, I still use today. And we had an excellent chairman who drilled things into us military style. And till today, I remember everything he taught. So
yeah. Wow, Philadelphia, we are blessed to have really good institutions teaching in
that's
some
true.
places.
That's
It's
true.
second,
That's true.
right after New York City. It's like one of those top places where you get a lot of residency and fellowship programs,
Yep.
and so that makes you very unique. You are a board certified complete residency program for neurology and internal medicine.
Correct.
You went on to continue to study. So where your life took after neurology? What did you do?
So then I applied for, I love critical care medicine, and I clearly love neurology. And I said the, most appropriate fit would be neurocritical care, which has components of internal medicine, neurology. At that time, this was 10 years ago, it was an up and coming field. It was, not very popular, but it just drew me. And I liked acute care neurology. And so I applied through that to the match, and I landed up in Baltimore, spent 2 years training at Johns Hopkins Hospital, and that was a phenomenal experience. And subsequently, then started working as staff at University of Maryland, where I spent another 1.5 years.
Yeah, I mean, John Hopkins is one of those places where if you have that on your CV, everybody would start your conversation at John Hopkins. I remember a friend of mine went to undergrad at John Hopkins, and he said, wherever I go in my interview, nobody asked me anything other than John Hopkins. So how that must have been a proud moment to get into John Hopkins.
For me, it was certainly, a huge, huge, feeling for me. But
Yeah, achievement.
yeah,
What?
but we had to leave Philadelphia, and that's what we were not that excited about.
Yeah, yeah.
But in hindsight, I think again, Johns Hopkins, just so you know, is the oldest program in neuro ICU. It's way ahead. It was way ahead of the game, and so I was
I
very, very,
Yeah. So tell us a little bit about what makes you unique now. You are a highly qualified physician with one over the other training. What do you do now? What is your job like?
So I'm a neuro-intensivist now, and for all practical purposes, my entire workflow is in the neuro ICU. I don't do any clinic or outpatient medicine.
Hmm.
We take care of everything that has to do with acute care neurology, which includes strokes and brain hemorrhages and brain traumas and spine traumas. So any neuro-related patient that requires an ICU. And so that's really what I do right now from a clinical standpoint. But because I'm at a university location, I also have an academic role here. So I am the program director for the Neurocritical Care Fellowship here, and we are the largest fellowship in the country. We have 10 fellows total. It's a 2-year fellowship, and so I have a lot of my time consumed by that. I also direct the medical school clerkship for neurocritical care, and also the sub internship. So I have an academic portfolio that takes up a lot of my time when I'm not, working in the ICU. And additionally, in the last few years, I've been keeping myself busy by just becoming a little bit better trained on some of the non-clinical, things in medicine. So I did a master's in healthcare innovation, which here at Penn, which has clearly added so much to my knowledge about modern healthcare.
Yeah, so I mean, there's a lot of things that we can talk about, right from neuro intensive care of patients with who are acutely sick, and I think that we would like to have some sessions on how you monitor a patient who had a subdural hemorrhage or an intracranial bleed and strokes, and we're gonna work on some topics to improve medical literacy on those programs. And having a person like you as a resource is would be an honor, to talk about it. Um, and I would like to know about the health innovation. So let's move on to our next segment, which would be. It seems like you have found a niche in what you like and what you are offering back to this medical community by teaching, and now you're innovating too. So w- is this kind of your dream job? What are you looking for to do now?
Yeah. So sort of rewinding to the time when I told you that I had a very traditional upbringing, and we didn't have as much opportunity or chance to explore what we like, what we don't like, and then pursue it. Over the last few years, I realized that we can't do everything, and we should choose our careers very carefully. And once we found what we like, we should pursue it and do it. And so that's what I have been doing. I have, no matter how rigorous the training or how many hours I have to spend, I will do it because I love what I do. And the whole innovation thing and the medical student and teaching and academic responsibilities, they all fall under that bracket.
So, give me an example of like you are probably a physician who works with uh, human mind and subtle responses of recovery. You are using a lot of technology. um, to actually identify and improve recovery of those patients. How would you tell this field to a medical student? What is it that you're doing here?
So an excellent question, and that's that's my one of my next projects, that I want to take everything I know and give it to the medical student who is just starting out, so that they can identify things early and realize what they really want to do. You
Hmm.
know, the worst thing that can happen is you don't have the right guidance and you end up in a field that you're not very happy with.
Yeah.
You know, and there's so much opportunity now for physicians to explore um, outside of the clinical realm. You know, so my master's, for example, had courses on behavioral economics and healthcare policy and healthcare operations and finance, and these are things that you're never taught in your training
Hmm.
as a physician. Right from day one to the final day of training, you're never taught about these things. And I think that healthcare, at least in the US, is so complex that one needs to know about these things so that they can be cognizant of it. They should know that um, how expensive healthcare is and how to be judicious about the testing they order, and you know just basic
Yeah,
stuff that's a
there's
part
a
of it now.
there's more awareness now about our use of resources, and being cognizant of the fact that we have to keep these resources available for a long time because people are living longer.
Yeah,
Now you're seeing roadblocks because now you have the vision, right? You're doing things, you also see roadblocks, and you have this background of health innovation to improve upon things. Give me some biggest hurdles of that you find in within your field or in medicine in general that needs to be taken care of.
I think um, the one of the hurdles that I've noticed is that, say you take a big healthcare system, that
Yeah.
healthcare system is making decisions from for employees, for the hospital, dealing with insurance companies, and there's different people designated to do those jobs. Uh, but I feel like there is not many places have a central figure that involves physicians to be part of that decision making. And so what ends up happening is you have a ground reality, which the guys on the top are not completely aware of, and then you have some big level, high level decision making to do that the folks on the ground are not aware of, and then mismatch creates a lot of medical waste.
Yeah,
And
that's
money is
that's a very
wasted,
good point.
resources are wasted, things like that. So I think that's the one of the biggest hurdles, that I'm unaware of what's above me and what's below me, so I'm going to keep doing what I do between the walls that I've been provided, and those barriers need to come down.
Barrier of you know this I agree with you. You brought those points you mentioned about uh, cost, wastage of cost and resources, and number two, lack of communication between the two parts of the health system, administrative and clinical. And I think the future generation would be part of physicians like you, who you are training, or being part of, who could be in the middle, who actually could see both sides and say this is where we should be. And at some point I think physicians would also need to be part of the cost assessment and decision making of the procedure, because sometimes patients would ask you or me or any other US physician why this procedure costs so much, and you're like, I don't know, I didn't make it. But in countries where we came from, although they don't have perfect health systems, doctors are part of decision making of what that cost should look like.
Right.
It's not perfect, but I think that here we are in a totally different segment of world, and we don't have any idea what costs are things. So
Right.
that's a good discussion, and I think it's I want to move on to a little bit of clinical aspect of your time as a neurocritical physician. When you are seeing families whose patients are sick and they are in your hands,
Mm.
do you find that time where you feel a lot of responsibility, and how do you deal with that to tell them that their family member may make it, may not make it, and how you tell them that you know what you're doing?
Yeah, that's one of the hardest parts about my job, is speaking with the families and loved ones, because in our ICU we see some of the sickest patients you can imagine.
Yeah.
Uh, they have ICU, they have problems with the brain, with other organ systems, and a lot of their functional outcome depends on how damaged the brain is going to be. And even though we have this advanced technology, we don't really know completely how the brain works and how well it's going to recover after the acute illness is over. So, we do a good job, I think, of communicating with the families, but that comes at a very high emotional expense, because to sit with them, to understand what they're going through, and to explain everything to them, and to watch them, um, sometimes cry, sometimes get very upset. It's heartbreaking, but it's a job that needs to be done, and I sometimes feel like, you know, I'm 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 happy that I can help them,
Yeah.
to this degree. Um, yeah.
I mean, definitely one thing that I can clearly see in you is compassion and empathy, and doing your best. And I think people, when they go home after talking to you, they would like sleep at least comfortably in whatever way they can. Is like that. If somebody is there, you're the right person to take care of their family members. How do you then come home, and then how do you shake off all that burden that you carry a day-to-day basis? Because a lot of physicians in critical care have high
Mhm.
burnout rate, right? I mean, it's
Yeah.
an intense job. So
Yeah.
what are you doing for
I
that?
don't think I can shake it off completely. I'm
Yeah.
not sure about how everyone else does it, but you know, some of the cases stay with you, and I can remember a lot of the cases, I would say, that deeply impacted me at an emotional level. Because after all, you're human. You can't be immune to all these emotions, no matter how hard you try. And we see them day after day, and some of the patients take a longer time to recover, and they're in the ICU for months. And so you that makes you in a very sort of unique position, because you're talking to their families almost on a daily basis for weeks, and you develop some degree of rapport. And I think that it's very hard to take it out of the system. In terms of what I should be doing, or what I try to do to get my mind off, is just pursue your hobbies,
Mm,
have good healthy practices at home,
yeah.
whether it's exercising, or even if it's watching a movie, or um,
Just yeah, and I know that you like to like stay active. Biking is one of your hobbies. We have talked
right.
about it. So
Yeah.
you must also spend a lot of time talking to other physicians, because I'm sure infection disease physicians and other what other specialists do you work closely in neurocritical ICU?
So we work very closely with other neurologists, like stroke neurologists, which is
Okay.
its own specialty. But we also, work very closely with neurosurgeons, because we have a significant overlap in what we do. And in terms of consultants, pretty much every other consultant comes into play one way or another, because
Yeah.
there are multiple organ systems involved, and sometimes we have to get more than one consultant on board.
Atul, you are still in contact with your friends back home.
Yep.
Is this field existing in India? And do you ever would like to share your expertise and knowledge with people outside your world in University of Pennsylvania? And have you tried doing something like that?
Yeah, absolutely. That To answer the first part of your question, this field doesn't exist in a structured shape or form back
Hmm.
home. I know there's a need, and people have told me that there is a need, and they are doing their best to do what they can. But because of the way the healthcare system is structured back in India, it's very difficult to make a breakthrough with a new field. You
With a
know,
new field, yeah.
So I did reach out to a few people, some hospital level CEOs, some private funders, but it's a difficult situation to
Yeah.
introduce a new field in itself
Because
by
first
ourselves
of
without
all,
actually.
people have to realize the need, and that what they're doing could be improved, and
Yeah.
that's takes a little bit learning curve and understanding the barriers, let going of those barriers. Or so is there a part of community in the world that your heart goes out to? I know as a physician, every patient deserves your love and compassion and your attention, but there's a part of community that you think that deserves help, and you want to reach out to more people through this forum and talk to us about them.
Uh, I've never really given it thought. I think, whatever I know is available for anybody who needs it.
Hmm.
Many people reach out to me, friends of friends, families of friends, and sometimes at odd hours. But I think if anyone could be helped by me, I'm happy to do it.
You're happy to do that. Thank you so much for offering that.
The
Um,
things that we do here affects everybody, every section of society.
sure,
It's not
sure.
one thing.
Well,
Yeah.
on the last question I want to ask you about is um, in a life advice, maybe somebody gave you, maybe you came to that conclusion on yourself. Is there something that you want to share with us today that, could be of anything in life that may help another person? Share a life pearl and advice.
I think for an aspiring physician, what I would say is if you are thinking of doing medicine, do it if you're passionate about it and you have the sort of emotional need to help somebody.
Yeah,
If you're doing it for some any other reason, I would say think twice about it because it's a lot of hard work and a lot of responsibility to do this job. And if you're not in it for the right reasons,
very
burnout
good
and
advice. Yeah, because with everything else, if if you're not, your heart and soul is not into it all the way, somebody's life is dependent on that. That
exactly.
that person's life is changed by what you do. So
Yeah.
um okay, well, thank you so much for this and nice advice and sharing your story, and I hope that I will be able to talk to you more about things in detail about the topics that you are more passionate about in neurocritical care.
Absolutely. Anytime.
Okay,
Anytime.
thank you, Atul.
You're welcome. Thank